Hello everyone, in today's episode of HealthTech with Purpose, we have Jack Hysell, Director of Integrations and Digital Partnership at Primary.Health. In this episode, Jack shares his fascinating journey from hairstyling to computer science, leading up to his pivotal role in revolutionizing healthcare technology. Stay tuned for a captivating discussion on the future of healthcare technology, including leveraging AI to enhance diagnostic workflows and strengthening public health infrastructure.
Hi, Jack. How are you today?
I am doing great. Thank you so much for having me today. I appreciate it.
Yes, and we were too looking forward to have this conversation given the great growth that primary health has been achieving over the years. And, it has been an interesting journey, which we would like to cover today. But before we get started into that, we would like to know a bit of your background. So can you tell us more about yourself and where did you started and, some of the things that probably life helped you learn?
Yeah, absolutely. So my journey to get where I am today is very non-traditional. So I'm a career changer. My very first career right out of the gate was in hairstyling. It actually had nothing to do with technology at all. But I always had a goal of going back to school, getting a four-year degree. It was always in the back of my mind. And about 10 years into that career, I had an opportunity where I started renting a chair. I had a lot of flexibility day to day to be able to take evening classes, weekend classes. So I jumped on that opportunity and very quickly discovered that I loved computer science. It was just a fun topic. There was a lot to learn. It was a far stretch from what my day to day was, and maybe that was kind of helpful in kind of planting the bug that got me excited about it. But I completed my undergrad in computer science and found myself first at Target. So you can see my little Target dog there in the background. I started there through their technology leadership program. Fell in love really quickly with the team, the leadership that was running that program, and also in the rotations through their engineering department. I really, really, really loved their the environment, the focus on growth and continuous improvement, and just always striving to be better was really what kind of captivated me about that team and the culture there. And I ended up becoming a program manager at Target.
Oh.
That actually was what propelled me into becoming a technical program manager at Primary.Health. Is I started to miss a little bit of the engineering side of what I did there, but really still enjoyed that program management piece. So a good friend of mine, who is now my manager at Primary.Health, Jack Hysell, she had reached out right when the pandemic had started to see if I was at all interested in coming to Primary to be an engineer. And when she learned that I was actually a program manager, she was even more excited because she, at that time, was our director of technical program managers. So it was just the perfect combination for me to be able to make a leap into startup and get to wear the hat of a technical program manager. So I started first with our integrations team. I right away at Primary was starting to build some preliminary integrations when I started. At that time, our platform was still, somewhat in its infancy. We had our integration engine, which had been kind of in the works, but predominantly a lot of the integration work that we were doing was happening from our front end, which managed our testing and vaccination services. So at that time, we were building some of our integrations just as an interim solution through our Databricks platform. And so I got to learn a lot about that, how to pull in orders. I got to learn a little bit about our data model and how things were structured. And that really helped set me up to be in the role that I'm in now as the director of integrations.
Great, great, great. Fantastic journey. Nice.
Yeah, it's a fun one.
Great. So, tell us more about primary health. And I must say, really cool domain name here. So, tell us, what does primary health do, and like a background, and what kind of problem primary health is solving today.
You bet. So we started in the pandemic. We really were there to kind of fill the need for rapid expansion of testing and vaccination services once those were available as well. What we were able to do in the beginning was build a platform that could quickly scale to meet the needs of the communities that it was in. So right away, the platform was enabled to power testing in communities. So it started off with I believe it was just 3 people. One of our engineers had flown out to Minnesota, actually, from California. And some of the first implementations of our product actually happened out here where I live in Minnesota, but later spread to California and Colorado and other states. And what that really turned into is a cloud-based platform for managing testing and vaccination programs at scale. And then from that stemmed the integration engine, which powered all of that, to be able to send those orders electronically to the labs that we were partnered with during that time. So you had really, really, really quick interfaces between the testing environments and the laboratories. We could get results back to patients very quickly. That integration platform is also lab agnostic. So we could integrate with any LIMS, any lab, very, very, very quickly, which was important during the pandemic. The other component to that, which we continue to do, is our health information exchange integrations. So being able to do the case reporting to the states, it was important for the states and epidemiologists and CDC to be able to track where the positive cases were. And also states have immunization registries, which we needed to be able to report to as well, so that they knew who's getting vaccinated. All that information was making it into the right place. So really it grew into this platform that could handle everything from start to finish. Providers could step in, run the operations on site to do those clinics and didn't have to worry about the reporting needs. Patients were able to get their results very quickly, very efficiently, which is super important. As we all remember during the pandemic, you might need to return to work and can't do so until you have a negative PCR test available. You might need to board a flight and you can't do so until you have that negative test. So it was really, really important work.
Right. So post pandemic, how primary health has continued to stay relevant and create value. Can you tell us more around that part?
Yeah, so I think, post pandemic, one of the things that is kind of present in mind, we were just at the NATO Preparedness Summit in Cleveland a few weeks back. And I think one of the things that stands out to me is we can't forget the lessons that we learned in the pandemic. It's important that we continue to be mindful of being prepared for the next event. We hope it's a long, long, long way away, but we know that to a degree that it's probably inevitable that there will be some spike, some emerging disease at some point that we need to be able to get control on. So one of the areas of focus is just maintaining that level of preparedness that we didn't necessarily have coming into COVID. But then the other part of that is how do we leverage a platform that was built for emergency use cases, for day-to-day purposes. And if it can handle emergency use cases, it's very well suited to handle the day-to-day. So what we've seen a lot of, especially recently, is the expansion of the platform to handle additional use cases such as STI testing, HIV testing, A1C, multiple modes of testing. Although we have not yet done it, we've also looked at, what are the use cases where perhaps we could support environmental testing. Essentially it's the ability to get a set of data from a provider or, someone out in the field collecting, samples, be it water or soil or air, whatever the case may be. How do we get that data to the lab where the testing is going to happen? And that's all very relevant, very doable from the platform that we've built.
Mm-hmm. Right. No, makes sense. It's always important to be prepared. And also, I think, the lessons that are learned, it's important to use them to build a better future.
Agreed.
So that being said, one of the other things that I could pick from Primary Health website is that you guys are very mission driven, and it comes out pretty much in all of your communications and as a brand. So tell us more about the health equity part and that you guys stand for, and like what is your definition of health equity, and how can it be achieved?
You bet. So it's a great question. The mission statement that we are driven by at Primary Health is to end the spread of disease. We want to reduce the severity of illness by powering simple and affordable diagnostics, immunizations, and preventive care at scale. And I think that is something that when I very first joined Primary was for me very captivating. That mission to me was immediately felt, and especially when you have the opportunity to be hands-on building those integrations, seeing the impact of what you're doing in communities, hearing the gratitude from the individuals that you're building it for, it really kind of, I don't know, it keeps you excited, it keeps you motivated. It got me up every morning ready to do more, ready to build more. So, for us, I think a lot of the health equity is almost inherent in the platform that we've built. We wanted to be able to be scalable in communities that were underserved. We wanted to be able to serve public health. And I think we've been able to do that really, really, really well. So I think that, in particular, one of the things that is top of mind for me is, how it has to be intentional, like real health equity. It's one of those things that it can't be bought. You can't just buy a solution that's going to enable health equity across the board for, the communities that you're serving or the individuals that are using it. It's one of those things that has to be intentional from the beginning. And without that intentionality, no matter how well intentioned a solution may be, you actually can do more harm than good. So some of the things that I think that we do really well, one of the use cases I think of often is in one of the communities where we've done some STI and STD testing recently. We wanted to learn a little bit more about the individuals receiving that test. Is the platform that we've built actually serving that community in the right way? Not just, those that are receiving the tests, but the providers that are also offering those services. And so after a couple opportunities where we were able to help support that testing event, we were starting to learn that in particular, this community, mostly migrant worker community from Mexico, although it was great that we were able to provide them a platform that is usable in their language, they could go on and they themselves could enter their own information, they could do the consenting. What we learned was that technology, although helpful, they wanted that human connection with a provider there on the site. And by learning that, by being able to partner with those individuals that were running that event, we're able to start tailoring that technology to be more useful on site so that it's not just a platform built for an individual to go on and self-register, self-consent, but for someone that's running that clinic, they can actually walk them through that form, actually guide them through that, and still give them that human connection that sometimes technology lacks, just because it's technology. It doesn't have that human touch to it. So I think that's one area where I see health equity being played out in what we're building and how we're interacting with those communities utilizing our technology.
Right, right. No, I think there's especially the user experience part that you mentioned. It's so important, in building modern solutions, because we're all talking about patient care, but it can only happen if all the stakeholders, especially the patient themselves, feel very much at home with whatever technology that they are using.
Absolutely.
Yeah. And in fact, one other thing that you mentioned was about enhancing and expanding your ETOR capabilities and strengthening the public health infrastructure through data modernization. So that piqued my interest. So can you go deeper on that one, Jack? Like, how do you plan to do that?
Yeah, absolutely. So I think the work that we're going to do there, first and foremost has to be led by the community partners that we're already working with. We had a really great opportunity during the pandemic to establish and build a lot of great relationships. And so now that we are beyond that and we're looking at these additional use cases, how we continue to grow and enhance those capabilities is really by learning what the needs are of the communities that we're serving post-pandemic. How can we utilize the existing infrastructure, the existing technology and capabilities that we've built to now serve the needs post-pandemic? And some of those needs are still the same. A lot of the pre-COVID processes, paper ordering, faxing in orders, manual entry of orders.
This episode of HealthTech with Purpose podcast is brought to you by MindBowser, a product engineering and digital transformation company focused on health. At MindBowser, we enable health companies to build the future of health where accessible, equitable, and patient care.
We strongly believe that technology can empower a healthier world, and that's why we are partnering with healthcare experts like yours to make it happen.
Hi guys, thanks for listening to HealthTech with Purpose. Make sure to subscribe us on Spotify, Apple, YouTube for more expert insights on industry innovation and transformation. And remember, share the knowledge.
Not much has changed since the pandemic, unfortunately. So there's still a lot of work that can be done there. And the technology is now in those labs. It's in those community partners' hands. All we have to do is just expand on it, create the training and the models around what we currently have to onboard them to these new processes. They've had an opportunity to get used to what that future can look like, at least through a couple test types. So now it's just a matter of expanding it to include more of the tests that they operate with on a day-to-day basis. So again, some of that is, through STI, STD tests, HIV testing. We're also seeing, use cases spring up in labs. One in particular that I had a conversation with, they receive breast milk specimens from a variety of different providers, and those all come into them in a CSV form, and they have to go through and manually type in every single one of those. Even though the technology exists to very quickly, very easily remove that manual workflow, that can all be imported. Those orders can all exist in their system in seconds. So how do we partner with them to learn about those types of niche use cases so that we can get those implemented for them and start making their lives easier?
Right. And I imagine that, there's a lot of interoperability play too for you because, like you can be inside the system, but this whole thing can only work when you are kind of interoperable between systems and be able to integrate. So, and I think especially for you, like these partnerships and, getting on the forefront of, making the right connections would become so important. So how has that part played for you? And, how has been the whole interoperability play for you guys?
So interoperability is definitely the new buzzword. As we saw when we were at Vive in Los Angeles, I mean, they had the entire interoperability pavilion, and I geeked out. I spent quite a bit of time there. It is probably one of the most exciting parts of my current work that I'm digging into. Without going into too many of the details just yet, we are working on currently establishing an interoperability network with one of the nation's largest public health lab networks. There are over 29 labs in total that we're working to connect, and it's a big undertaking, but so many of those connections were already built during the pandemic. And so we already had a little bit of a head start there. And where we're really at now is establishing kind of that baseline, building that infrastructure to enable ordering between those labs for seamless interoperability. And that use case just being that should there be another pandemic, should there be an emergency or a natural disaster that renders a lab, incapable of processing orders, they need some way to ensure continuity of operations. They need to be able to offload the specimens that are sitting in their lab, whose results are important to the patients that are waiting. They need to be able to get those orders sent off to another lab quickly and reliably. So how do we do that? And how we do that is through Connect, which is our proprietary integration and interoperability engine. We've essentially created that normalization layer where all of these labs that we've built connections with, we can take in those orders, we can normalize that data. And then because we've already had those integrations established with the other labs, we know how then to push orders into those labs utilizing their standards. It's a challenge because if you've seen one lab, you've seen one lab. They all reside in different counties. They all have different limbs. They all have different requirements based on the communities that they serve. But that's where that normalization layer comes in really, really, really beneficial. So again, being able to bring in those orders, normalize that data, and then being able to transmit those orders to a lab who can process those on the other lab's behalf and get those results out to those patients quickly. That to me is kind of that, again, going back to when I very first started being able to build integrations and now being able to ensure continuity when that order that you send off may not be processable by the intended lab is just another source of pride and kind of gets you up in the morning and ready to go.
Right, right. And you are heading partnerships. My curious question is, what's your favorite partnership story?
Oh my gosh. There are a handful. I think the one that gosh, anyone that's listening, if I don't mention theirs, I feel bad, but the one that's coming to mind at the moment has really been in San Francisco. And I think what is great about that partnership is the ability to really reach into communities that might not have the access to affordable testing, affordable diagnostics, affordable care, and being able to provide that for them. So the use case that I shared earlier about being able to enable STI, STD testing in migrant communities, that is one of the areas where we've been able to help make that happen. And it's really rewarding to see, the ability of our testing to go from COVID to serving these day-to-day needs and helping individuals receive access to testing that would otherwise be out of reach, to put healthcare in their own hands, to give them the ability to, seek care, take care of themselves, protect themselves and their community is really, really rewarding. And it's going to be exciting to see how we continue to develop that, how we're able to expand that to reach even more individuals throughout that community. So I think that one in particular really stands out to me.
Right. And what do you think of AI? In your world of testing and, finding, I'd say, predicting health with better workflows and so on. So where do you see AI happening? And are there any live deployments that you guys are already seeing, or how is it for you guys?
Yeah, that's a great question. At the moment, as far as AI implementation goes, we don't currently have anything solid for that. One of the areas, though, that we're really excited to explore and maybe implement some elements of AI, though, are in the digital rerouting of orders or within a lab setting where an order is brought in via a paper fax, being able to scan that order, being able to digitally lift information from that order and put it into that HL7 or FHIR format, whatever the case may be, for that lab, and get it submitted into their LIMS system so that it's ready to be processed right away. Those are areas where I can see immediate adoption of AI. And how that can be helpful is in validating that the information that you're lifting from a document is accurate. What is the confidence interval that that the date of birth that you've pulled from that form is actually a date of birth and not the date that the test was performed, or that the values are accurate if it's trying to read handwriting versus something that's typed out. What is the confidence interval that it was able to accurately grab that information? So that's one area where I can see some usefulness in AI in what we're doing. And I'm sure there's plenty of others.
Right.
But and that was something that I think was really interesting to see in some of the recent conferences as well, as AI is starting to kind of come into healthcare. And I shouldn't even say starting to come into healthcare. It's here. It's already happening. It's not starting.
Yeah, let's do that. In fact, surprisingly, AI adoption or AI talk has been faster in health as compared to like other technology innovations that have come, and healthcare has just been the same.
Right.
So let's see, like what how it unfolds. But question to you, Jack. What are Jack's goals for 2024 and 25, and maybe long term, and why?
Oh man, there are I think there's so many goals. Really the biggest one right now is, how do we create this sustainability in the platform that we've built, in, getting into more communities, being able to connect, not just within a state's ecosystem, but state to state. I've heard through conversations at conferences as well that, as we all know, disease is not confined by borders. So how do we help increase the sharing of information between communities, across state borders, across, county or country borders even? Not only do they spread state to state, but they spread country to country, to Canada, to Mexico, in between. So how can we help support the collection of that data? How do we get diagnostics into the hands of individuals performing testing in those locations that could be useful to track the spread of disease as it moves across those borders? I think those are really, really great goals to have going forward, in determining, how do we get there? Who do we partner with? How do we make that happen? So if you're listening to this and you have thoughts on that, and you already are doing it and want partners in that, here we are. Let's talk about it. And then also just being able to expand this product to more communities. One of the things that, again, I feel like we do so well is partnering with public health. We understand that in public health, there is a lack of funding, often a lack of, staffing and resources. So what we really like to do is partner with the public health labs, the public health agencies, to see where we can utilize existing grant funds to do this work. How do we make this affordable? How do we make it attainable, so that everyone involved benefits from it? And in doing so, we're just creating more data, more information that can be utilized by epidemiologists. We have opportunities to maybe even enhance and set some of those standards going forward for data collection, so that we can really think more about health equity. What are the things that we can do with that data to help improve access into communities that maybe don't currently have it, or to improve the healthcare that they're able to attain. So I think these are some goals that are just very high level, but I think have big impacts if we can do it and get it right.
Right, right. And of course, you start from somewhere. So, it's always good to start with a big goal, and then, keep
You work your way
chucking.
back.
Yes. Keep
Exactly.
taking a piece of it. Yeah. So my last question that I would really be curious about is, what's your favorite story of the impact that primary health has created for any community, and what was it like?
So I think overall, it's going to be broader than one community. And I say that because I think, the story of, who we are, where we started from, and what we were able to do with this tiny but mighty startup crew is pretty fascinating. we really had an opportunity to touch the lives of roughly 4% of the United States, which doesn't sound like a lot, but when you think about, a crew at the height of the pandemic
That
around,
already sounds a lot.
it's a lot. Yeah. That's many millions of individuals whose lives we were able to touch through testing and vaccinations. We supported over, nearly 10 million patients, 1.6 million doses of vaccines administered. And that's across, 20 different immunization types. There was really a huge impact that we were able to have in a very small amount of time. And I think that's the other factor. Those numbers, relatively speaking, may not sound, as impressive depending on the scale, the scope that you're thinking of. But when you confine it to just those, that time frame of the pandemic with the crew that we had, it's rather remarkable. And so I think, for me, for a lot of us at Primary, that's a source of pride, is how quickly we were able to get into those communities and really do some amazing work for them. So I have to give, I would be remiss if I didn't give a shout out to all of the individuals that make that happen. We have an amazing engineering team that continues to push out just remarkable solutions to the problems that come up every day. We have an amazing customer support team that is always ready to help when things arise. Our leadership team, they have the difficult task of charting the waters ahead and keeping things moving along. And so, really it just takes an effort from all of us to do the work that we've been able to do, and we'll continue to do because of the relationships that we've built, and the lasting work that we've also put out into those communities.
Great. That's inspiring. Yeah, because not many companies or startups especially get a chance so early in their life to make such an impact. So
And we're
yeah,
fortunate
that's
as well that, I mean, we came in at a time where, the future was really unknown. And what we've been able to do is survive through the pandemic and now beyond the pandemic. And that is not an easy thing to do. Some of the biggest challenges there are, the ending of the emergency funding for COVID. How do you continue beyond that? How do you, stay relevant? How do you modify your product?
right.
And
So I see like those lessons that probably the team has learned so early as a team as compared to, like sometimes ages go by and you don't have that kind of exposure possible. So that's such a great and interesting thing. Good. Thank you so much, Jack, for the talk today, and thoroughly enjoyed this conversation. A lot of takeaways and learnings, and I believe that our viewers do enjoy it as well. So looking forward, and we wish you all the best for your goals.
Thank you. I appreciate it. This was my first podcast interview, so this is a great opportunity, a great learning experience, and looking forward to seeing you again at future conferences.
Yeah. Same here. Thank you.
Thank you for joining us on the Health Tech with Purpose podcast. Before you leave, make sure to like and subscribe on Spotify, Apple, and YouTube. And if you would like to see someone on this podcast, do refer to us. My contact details are in the description. Before I leave, I wish you stay healthy, stay curious, and keep building.